Hello mga kamarinela, mga mahal kong tranela, ano ang latest? So this is Nurse Chrissy and nagbabalik para magbigay ng kaalaman sa inyo. So for today's video, we'll be talking about Androcure. So but before anything else, I'd just like to give you a disclaimer regarding Androcure. So this video is not intended to prescribe Androcure. This video is actually intended for those trans women who are using Androcure without any advice of healthcare provider. So I am not a doctor, I am a nurse by profession. So ideally, I am encouraging each trans woman to consult an endocrinologist for you to be able to get a right prescription regarding Androcure. So again, I'm just doing this video for the sake na sa mga trans woman na hindi accessible yung endocrinology sa kanila at syempre walang kakayahan para magpakonsulta sa endocrinologist. And a lot of trans women in the Philippines are just resorting from themselves for self-medication. So sad to say na dapat hindi natin ginagawa iyon dahil Androcure is one of the potent anti-androgen and maraming risk ang paggamit ng Androcure. But since I am here and meron akong knowledge regarding these medications, I would just give you some details about Androcure. Ano ba yung content, mechanism of action, side effects, and everything. Guys, for those who wanted to join my group, this is my group. At dyan po kayo pwedeng magtanong sa akin. I am very much active on that group. And a-answeran ko po lahat ng tanong nyo dyan. So, this is also my Facebook, this is also my Instagram for any questions or everything. So, but I would encourage you to join my group para dun tayo magchikahan. So, you heard it right that we will be talking about Androcure. And this is one of the famous anti-androgen na ginagamit ng mga trans women. Huwag na natin patagalin. Ang brand name nito ay Androcure, Androcure Depot, Cyprostat, at saka Cyterone. Again, ito po are all the brand name. And yung kanyang content or yung kanyang generic is yung tinatawag na cyproterone acetate. Yan yung nilalaman ng Androcure. So, ano yung stock dosage ng mostly na ginagamit ng mga trans women? And these are 100 mg and 50 mg. Mga ano to, tabletas ito. Yes, you heard it right na meron tayong tinatawag na Androcure Depot. Ito po yung injectable. But injectable Androcure is not necessary for trans women. Masyado na po itong mataas para gamitin ang isang trans woman. Kasi ang gusto lang po natin is maging babaihan. But Androcure Depot is mostly used for those patients with prostate cancer. Ngayon sa Pilipinas, meron na ring nagbebenta through online ng cyterone acetate. Again, this is just the same with Androcure. Mga brand name lang po ito. Yung country of origin naman na tinatawag, if you will buy to any seller, they have different country of origin. Okay lang ba na yung Androcure is galing sa Turkey, galing sa Germany, galing sa Middle East? Again, okay lang po. The most important thing is the content, which is the cyproterone acetate. Country of origin has nothing to do with the effectiveness of yung Androcure. Kahit saan pa yan nanggaling, effect pa din yan. Like what I've said, ang importante is cyproterone acetate, which is the content. So as a trans nurse, I want you to be knowledgeable regarding kung ano yung mga iniinom nyo. Hindi yung inom lang tayo ng inom na hindi natin alam kung ano yung iniinom natin. Let's proceed now to the mechanism of action. Ano ba yung gamit ng Androcure? It is an anti-androgenic hormone preparation. Cyproterone acetate has a progestogenic action, exerting a negative feedback effect centrally to the hypothalamus receptors. Again, yung hypothalamic receptors is located po ito sa hypothalamus. And hypothalamus is one part of the brain. Ito po siya. So leading to a reduction in gonadotropic release and hence a diminished production of testicular androgen. Paliwanag natin mabuti kung ano ba yung gamit ng Androcure sa Tagalog. So ayun nga, yung cyproterone acetate, pag tinik natin sa katawan natin, mag-exert ng negative feedback effect sa hypothalamus natin. ang affinity nito is sa hypothalamic receptors. Ano ba yung gamit ng hypothalamus natin? It is a gland from your brain that controls your hormone system. So since we are talking about hormones, ano ba yung pinag-uusapan natin hormones dito is yung male hormones, the androgen. Since cyproterone acetate ay meaning pampestop, pang-block ng androgen natin. So, syempre ibablock niya yung hypothalamus receptors natin. Ngayon, yung hypothalamus naman, hindi ito magre-release ng gonadotropin releasing hormones. Ano ba yon? Ano ba yung hormones na yon? It is secreted by specialized nerve cells in the hypothalamus of the brain. It is a release into tiny blood vessels that carry the hormones from the brain to the pituitary glands. Yung yung pituitary gland, siya yung nagpo-produce ng follicle stimulating hormone, luteinizing hormones. So, itong follicle stimulating hormones and luteinizing hormones, ito yung nagpo-produce sa mga babae ng egg cell, sa mga lalaki naman is sperm cell. So, sa madaling salita, kung nagtitik tayo ng cyproterone acetate, nabablock yung pagre-release ng gonadotropic releasing hormones. So, hindi magsisikret ng hormones yung brain natin sa pituitary gland. Tapos, hindi ngayon magpuproduce yung pituitary glands ng luteinizing hormones at follicle stimulating hormones, kaya wala makikreate na sperm. Okay? Sana naintindihan nyo po. Yun po yung gamit ng Androcure. Kaya nga po sa mga gumagamit nito, napapansin nyo na isa is pag nagmamasturbate kayo is wala nang lumalabas or decrease na yung paglalabas. Tapos lumiliit na yung itlog nyo kasi nga since binablock nyo yung triggering factors sa brain nyo, hindi ngayon magpa-function. I mean, magli-lessen o magdi-decrease o hindi ngayon magpa-function yung testicles nyo to produce the sperm. Kaya, mostly liliit yan at yung sex drive nyo is nawawala po. So, ayan. Kapin muna tayo. So, proceed tayo sa side effect. Kung ano ba yung mga common side effect na mararanasan natin pag nagtitake tayo ng Androcure. Yung tiredness and fatigue. Meaning, palagi kayong walang energy. Parang pagod na pagod. Tapos, wala kayong energy. Tapos, weight change, headache, depressive mode. Ayan. Kaya yung mga kasisi natin dyan, isa rin ito sa nagkukos ng depressive mode dahil like what I've said, Androcure, ang apektado is yung hypothalamus natin and one function nito is yung emotion natin. Next is nausea and gastrointestinal complaint, decreased sexual drive, yun yung sinasabi ko, breast pain, change in the breast size, breast swelling, and tenderness, breast enlargement in men. So, yung mga sinasabi ng mga iba na tinatanong kasi nila minsan, ano ba yung ititake nila hormones na hindi sila magde-develop ng breast. And most of the seller, most of the trans, advice nila is Androcure. Mali po tayo. You can still develop breast enlargement with the use of Androcure. Mali po yung sinasabi ng mga iba na ito yung gamitin mo lang yung Androcure, huwag ka nang mag-estrogen, hindi lalaki yung breast mo. Lalaki pa din po. May tinatawag tayong gynecomastia or breast enlargement. Lalo na sa mga men na gumagamit ng Androcure. Tapos, ayun nga, hot flashes, sweating. Ayan, hot flashes and sweating, naranasan ko yan. Like tuwing gabi, like kahit na malamig, parang nagkakaroon ka ng hot flashes and sweating. Punta naman tayo sa complications. Nasabi ko mga kasis, huwag po tayong umiinom ng Androcure basta-basta or nag-overdose o high dose without any prescription ng doktor dahil sa mga komplikasyon na pwede nating maranasan. So, kung wala naman kayo, if you don't have any capacity or hindi accessible yung endocrinologist nyo at you resort from self-medication, then my advice is go for minimum Dosage. So ano pa yung mga complication na pwede nating makuha while using Androcure? We had cardiovascular disease, blood clots, liver toxicity, including hepatitis, liver failure, liver cancer, excessively high prolactin levels. Then a certain benign brain tumors like meningioma, tumors of the meninges, prolactinomas, prolactin secreting tumors in the pituitary gland. So yun yung mga complications. At isa pa, okay, ito yung sinasabi ko rin na isa, when you are using Androcure, you do not discontinue Androcure abruptly. Hinay-hinay po yung pag-stop ng steroids, lalo na pag sa mga nagtitake ng matataas at nag-overdose, mga long-term user ng Androcure, please do not discontinue Androcure abruptly. Dapat pakonti-konti. And discontinue nyo ito ng biglaan, magkakaroon kayo ng adrenal insufficiency. Ito yung withdrawal effect ng Androcure. So don't worry, we will be talking about this in my next video regarding adrenal insufficiency and how to stop Androcure in napahinay-hinay lang. So like what I've said, I am not a doctor, I'm a nurse. This video is just intended for those who hindi nagpapakonsulta sa doktor. I'm not encouraging you to resort from self-medication. Pero syempre, hindi maiwasan ng iba na mag-self-medicate. Ang sinasabi ko na lang is, just take 1/4 tab sa 50 or 100 milligram per every day, every other day, every third day, every fourth day after meal. Pwede nyong isabay ito sa estrogen nyo kung oral, yung tinitik nyong estrogen. Bakit sinabi kong every other day, every third day, and every fourth day? It is because the elimination half-life ng Androcure sa katawan natin is yung half ng effect ng Androcure ay umaalis siya within 1.6 to 4.3 days. So, meaning nag-i-stay ng longer ang Androcure pa din sa atin. Kaya you can use it every 4 days, every third day, every other day, or every day. Next video is tuturuan ko kayo kung paano ihatiin yung tabletas ng Androcure. Actually, gagamitan natin ng sentido común or common sense. It is 1/4 of 50 or 100 milligrams, meaning hatiin mo sa apat yung tabletas ng Androcure. May dalawang shape yung tabletas ng Androcure. Pwede itong oblong, pwede itong bilog. Kakat ng cake. Okay, you cut it half. Yung half, ikakat nyo sa half bends para makuha nyo yung 1/4 tab. Combo ng, okay? Paano ba i-combo ang Androcure sa ibang hormones like the estrogen and progesterone? Kung meron kayong Androcure, you just pair it with another pure na estrogen. Okay na yon. For example, Androcure plus Primarine, Androcure plus Progenova, Androcure plus Astrofem, Androcure plus estradiol benzoate, Androcure plus Progenon Japan. Pwede yon. Kapag naman i-combine nyo yung Androcure with the combined hormones, pwede naman. Pwedeng Androcure plus Panokinon, Androcure plus pwedeng Lady, Androcure plus Micro, pwede yan. Ganon. Wag lang yung Androcure plus Dayan. Androcure plus OC35, Clement. Kasi po, ito pong yung Clement, Dayan, OC35, Yasmin, ano pa. Ayun, meron na po itong mga anti-androgen that you no need na magdagdag pa ng anti-androgen. So, next naman tayo is sa mga bawal while taking Androcure. Unang-una na dyan is drinking alcohol. Okay? We know that alcohol is already toxic in our body, lalo na pag nadamihan. And alcohol is also hepatotoxic, and Androcure is also hepatotoxic. So, putting together, you are just putting your body at risk to develop complications. The next one is smoking. Marami pong sakit na makukuha sa smoking. Okay, pwede tayong may stroke because of the smoking. And smoking plus Androcure, smoking, nagbabasoconstrictor, lumiliit kasi yung yung daanan, yung ugat natin kapag nag-i-smoke. And tapos, ang Androcure naman, ang isa sa complication niya is yung blood clot. Tapos, cardiovascular disease. So, putting together will result to pwede tayong may stroke, ganon. Or any disease na pwede nating makuha. O pwede tayong makakuha ng cancer. And also, sa pagtitik ng Androcure, one of the complication is pwede tayong makakuha ng cancer. So, yon. Tapos allergy sa content. Paano natin malalaman kung allergic tayo sa Androcure? Pag nag-take tayo is, kinati tayo, nahirapan tayong huminga. Tapos, nagpantal-pantal yung buong katawan natin during sa pag-take. And do not take Androcure if you have any of the following conditions. Liver disease, previous existing liver tumors unless they are caused by metastasis from prostate cancer. Vin-Jansen and Rotor syndrome. History of jaundice. Previous of existing benign brain tumors. Meningioma. Wasting disease. A disease causing muscle loss, loss of strength, ganyan. Severe persistent depression. Previous existing condition relating formation of blood clots. Severe diabetes with blood vessel changes, sickle cell anemia. Tapos, at isa pa kapag meron tayong osteoporosis. Androcure is nakakabawas po ng density ng bones natin. Take kayo ng medications like phenytoin. It is a medicine used to treat epilepsy. Dapat hindi kayo gumagamit ng Androcure. Medicine used to treat fungal infection like the ketoconazole, itraconazole, clotrimazole. Ritonavir, a medicine used for treatment of HIV. Dapat hindi tayo nagtitake ng Androcure. Rifampicin, yun yung medication for tuberculosis and leprosy. St. John wort o yung a herbal remedy used to treat mood disorder. Tapos yung mga statin, medications na pampababa ng cholesterol. At yung mga medicines used to treat diabetes. Dapat hindi po tayo nagtitake ng Androcure. So, ayun nga guys, effect pa rin ba pag iniinom lang is 1/4 tab every day? Yes, effect pa din po yun. Makakablock pa din ng anti-androgen nyo. So, pwede bang gumamit ng vitamins, supplement, like collagen, glutathione, while taking Androcure? Yes, pwede po. And I would really encourage you to take supplements, vitamins sa umaga, tapos yung Androcure nyo sa gabi together with estrogen. Dahil one of the side effect ng Androcure is panghinang ng katawan, parang walang energy. Kung nag-work kayo, so mararanasan nyo itong mga side effect na ito. That will affect your work performance. Yung iba nagtatanong, nagtitake ako nito, masakit yung mga kalamnan ko. Yes, that is one also sa mga side effect ng Androcure po. Pwede bang gumamit na lang ng Androcure without any estrogen or any progesterone? Pwede po. Pwede nyong gamitin lang yung Androcure. Pero pwede pa rin kayong mag-develop ng breast. Kasi may tinatawag na tayong gynecomastia. You can still develop the fat deposit on your breast. Kindly stop na sinasabi nyo na Androcure lang gamitin nyo dahil gusto nyo lang ng babaihan na katawan, ayaw nyo mag-develop ng breast. You can still develop. I am 40 years old and I want to use anti-androgen. Again, 40 years old and above, you know that this age is already like a trees wherein may marami nang nararamdaman na mga sakit. I mean, marami na tayong nararamdaman na condition sa katawan natin. And the physiological and anatomical structure of our body is decreasing. I would suggest na magpa-konsulta sa endocrinologist for your safety. Naman nagsi-self-medication kayo, alam ko marami nagsi-self-medication, even though na kayo, may mga edad na, I would suggest na take the minimum dosage. May mga nagtatanong din sa akin, meron akong diabetes, tumataas yung presyon ko, at iba pang mga kondisyon. Go back to your healthcare provider, to your physician, and ask them so that aware po sila na gumagamit kayo ng Androcure. Huwag kayong ng advice from others dahil they don't know your history, your medical history. Lalo na pag kunyari may mga condition kayo, may mga underlying diseases kayo like tas ng BP, ganyan, pag may diabetes, ganyan. So, pakonsulta po tayo sa doktor. Huwag po tayong mag-ask ng advice from others. Even me, pag nag-ask yung mga trans natin na mayroong kondisyon, may underlying diseases, underlying factors, underlying medical history, hindi ko, sinasabi ko na hindi pwede. Kung mapilit pa din, then take at your own risk and I would suggest to consult your healthcare provider. So, thank you so much mga ka-Marinela, mga mari kong tranela. And thank you for continuous support. And I hope na natuto kayo regarding Androcure. I want to ask your like, support, share with my videos kasi nga I know for a fact na very detailed, maraming informasyon na pwedeng malaman. So, i-share nyo na lang din sa mga kasisi natin. So, I'm not after for yung salary sa YouTube, but I am after for your knowledge regarding sa mga HRT. Kasi alam ko maraming nagsa-self-medication.